Authorities stop a child from getting on a plane at BWI Marshall after he unknowingly tested positive for COVID-19. WJZ is live at the airport. Annie Rose Ramos explains how the state quickly tracked down the family. Annie Rose?
This was such a close call, Lynn. Good morning. Well, police say officials were able to get a hold of the family just 45 minutes before they boarded their flight and potentially infected a plane full of passengers.
It was quick action from a network of Maryland officials that stopped a plane from taking off at BWI with a COVID-infected passenger. Maryland State Police say the day before Thanksgiving, they were contacted by a health official on Maryland's Eastern Shore about a 9-year-old boy who tested positive for coronavirus. Officials say they were unable to get in contact with the child's mother, but knew the family had plans to travel to Puerto Rico from BWI on a 4:15 flight out. State police say they immediately sprung into action.
We got the call at the state police at 3 o'clock and immediately contacted our partners at the Maryland Transportation Authority Police that are primary at BWI Airport. We got enough information that we were able to provide to them so they could begin to look for the two individuals.
With the clock ticking and 45 minutes until takeoff, police say the family was located before they even boarded the flight.
It's pretty cool that they were able to do that. I mean, that's saying something that they were able to track them down at all.
Officials say the mother was unaware of her son's positive test. Police say examples like this one show the level of effectiveness of state agencies coordinating in COVID-19 compliance enforcement.
We really can't predict what could have happened with the spread of the virus, but what we do know is that by that quick communication, we were able to reduce that opportunity from ever occurring.
And Tim, the mother is currently cooperating with Wicomico County's health department, and the boy is now in isolation at home. Reporting live, I'm Annie Rose Ramos for WJZ.
Thank you, Annie Rose. It is 6:34 now. Maryland continues to battle the raging coronavirus. The state is reporting 42 more deaths, marking the highest single-day death toll since early June. Now, this after another day with more than 2,000 new infections. Maryland is creating a plan now for how the vaccine will be given out and who will receive some of the first doses. WJZ investigator Mike Helgren with what we're learning about plans for distribution.
Everyone is not going to get a vaccine or the ability to get a vaccine right away.
Maryland's lieutenant governor says the first batch of 150,000 vaccine doses should start being distributed by the middle of this month, pending FDA approval. After frontline healthcare workers are vaccinated, the next group is at nursing homes.
Because the staff are the ones who are transient. They are the ones that we saw last spring that were bringing it in unintentionally.
The last data I saw suggested somewhere between 40 and 50% of people are planning on getting the vaccine. That's nowhere near enough to knock this virus down.
Loyola University immunologist Dr. Chris Thompson is excited about the vaccine, but acknowledges there will be challenges.
And how do you pick and choose between which frontline workers get it and which ones don't?
Baltimore City alone reported 9 new deaths. At a meeting of the city spending board, the city attorney praised outgoing Mayor Jack Young.
There is no mayor who has had to weather ransomware and then COVID. And you rose to the occasion. I will always believe that you saved many, many lives.
There are a lot of unanswered questions that I believe need to be clarified.
At the state spending board, the comptroller raised questions about almost $10 million in taxpayer money Governor Larry Hogan spent on tests from South Korea. The acting health secretary says the first batch was flawed and never used, and the state paid more than $2 million extra for replacement tests. The acting secretary revealed the entire purchase is now being audited.
At the time, because of the crisis we were in and we wanted the tests, and it's turned out to be a good thing we had them.
The acting secretary says more than 80% of those Korean tests have been used, and he dismissed concerns about false positives. At Baltimore City Hall, Mike Helgren, WJZ.